For that introduction. I appreciate it. I'm going to kind of minimize things so I can see everything. Thanks everybody for joining. I'm honored to be speaking to you today from Sackville, New Brunswick, the land of Mi'kma'ki, which is the traditional and unceded territory of the Mi'kmaq people. Today, I'm going to share with you the results of this study on sea level rise and health that was undertaken in partnership between CLIM Atlantic and the NCCEH. When this project was proposed to me last year, I had just wrapped up the New Brunswick Health Adapt project, as Leah mentioned. It was one of 10 pilot projects across the country funded by Health Canada. The purpose of the Health Adapt project was to undertake climate change and health vulnerability adaptation assessments. So in New Brunswick, we were testing out the approach in 2 communities, both of them having coastal connections. Ironically, while we discussed sea level rise generally as something to be aware of, we never once considered the health impacts of sea level rise directly. So this opportunity was a very timely one for me to consider health impacts from that very specific perspective. I'll start with a brief introduction of CLIM Atlantic, and then we'll get into the discussion on the project itself, including a description of each of the 4 phases and the findings in each. And then we'll end with some overall project thoughts, leaving time for questions at the end. Before we get started, though, we've got a quick poll question for you. I'll get Leah to post that one up.
Sorry, Tracy, I just seem to not have access anymore. Juliet, would you mind seeing if you could run that poll? Thanks. If you go to more, it should be.
There we go. So the poll, I'm just basically wondering who's out there, who's participating in this. Lots of people from public health, it looks like, and some local government, people with climate adaptation backgrounds. Just a few land use planners, so I'm glad there's a couple of you out there. But very much 3/4 practically are public health, it looks like. So that's great. Well, welcome everyone. I again appreciate you being here for this presentation. So before I get into the project, I want to tell you just a little bit about CLIM Atlantic. It's the regional hub for climate services in Atlantic Canada. It was created in 2021 in partnership with the Canadian Centre for Climate Services and the 4 Atlantic provincial governments. Its mission is to provide those in Atlantic Canada with information and support to consider climate change impacts in decision-making. CLIM Atlantic facilitates access to regionally relevant climate information and supports its effective use in planning and decision-making for New Brunswick, Nova Scotia, Prince Edward Island, and Newfoundland and Labrador. So if you do have any more questions about CLIM Atlantic, I'm not going to talk about it anymore right here, but that is our website. I think it's on virtually every slide. So please feel free to go and take a look. So the purpose of the project today was to gather information on public health risks associated with sea level rise and to see if and how impacted communities had integrated public health measures into their adaptation planning for sea level rise. There are 4 phases to this study, as we alluded to in the agenda, with the first one being the identification of the areas of Canada's coastline with that were most exposed to sea level rise. As we'll discuss, not all coastlines are going to be impacted equally. The second phase was to review the literature to identify health impacts from sea level rise specifically, so either direct or indirect. Third, we undertook a review of community-based approaches to adaptation planning by looking at climate adaptation plans, vulnerability assessments, and land use plans. So that we did that analysis. And then the 4th phase of the project, in consideration of all the other project findings, the goal was to understand how health could be better integrated into community-based adaptation planning for sea level rise. So part 1, first, it's probably important to start with what we mean by sea level rise. Global sea level is rising as a result of increasing global temperatures. Warmer air means more freshwater input from melting glaciers and ice sheets into the ocean. As well, increased temperatures also heat and expand ocean waters. So that's happening globally. Relative sea level rise is the local amount of increase that in sea level along Canada's or any coastline. So in Canada, it's very different from one place to another. It depends on localized geological processes, such as the vertical land movement as a result of continental drift and post-glacial adjustment. So to identify the areas of Canada's coastline that would be most exposed to sea level rise, we started with this map developed by the Geological Survey of Canada in 2021. Global projections for sea level rise are approximately 1 meter by 2100, but based on more recent IPCC recommendations, this map includes the potential addition of another 65 centimeters, assuming the partial collapse of the Antarctic ice sheet by 2100. So vertical land adjustment is dramatically illustrated in Canada. The Hudson Bay region and the Canadian Arctic archipelago in this area are both experiencing uplift, which means that the land elevation is rising incrementally, thereby reducing the impact of sea level rise. However, in Atlantic Canada, and to a lesser degree in the Northwest, the land is sinking. So that's resulting in an additional 17 to 20 centimeters estimated by 2100, in addition to all those other factors related to sea level rise. While there isn't very much vertical land movement in British Columbia, that is a pretty densely populated region, and there'll still be some impacts from sea level rise in that area. To be clear, the study is only looking at sea level rise, so climate change will have significant impacts on all areas of Canada, and the North is being and will continue to be dramatically impacted, just not by sea level rise specifically. So in terms of the focus for this project, we identified 3 regions really in Canada that have the highest exposure. So in Atlantic Canada, it includes PEI, Nova Scotia, New Brunswick, and Newfoundland, Labrador. You can see that this area is projected to have the highest impact from sea level rise, with the brightest purples, up to 180 centimeters, which includes the subsidence factor by 2100. The Beaufort Sea area here in the Northwest Territories is looking at 120 to 160 centimeters of sea level rise by 2100. The Yukon is also impacted, but because this was looking at communities, there's no communities specifically in that area of Yukon. It's a territorial park in that region. Coastal BC is less impacted in terms of the level of sea level rise, only expected to experience 100 to 140 centimeters of sea level rise by 2100, but the sheer population in the risk area necessitates its inclusion in this project. So we'll zoom in a little bit more. In Atlantic Canada, there are several key areas that are at highest risk for exposure, and they're highlighted here. So there's the Chaleur and Acadian Peninsula region in New Brunswick. There are many small coastal communities and only a few urban centers, and the urban centers themselves are actually quite small in comparison to other areas. We've got the Northumberland Strait region, which is here. So it impacts 3 provinces, PEI, New Brunswick, and Nova Scotia. It's very low lying and highly susceptible to coastal impacts like storm surge and erosion. Hurricane Fiona last September caused significant damage along this coastline, as well as the northern coast of PEI. The Chignecto Isthmus is the land bridge that links Nova Scotia to the rest of mainland Canada. This is actually where I live. It's a very low-lying marsh area that is protected by historic dikes and the CN rail line, most of which is well below the 2100 flood projections. In the Atlantic coast, this area right here, D, it includes a whole bunch of small communities along this coast. It also includes the Halifax Regional Municipality, the Gulf of St. Lawrence. So this area here, so it's northern PEI as well as the Magdalen Islands. Normally we don't include, Quebec is Atlantic Canada, but the Magdalen Islands are a unique feature here, and of course are definitely part of this, the considerations for this study. If any of you have never been to the Magdalens, it's a chain of islands that I think the 3 main ones are connected by very low-lying coastal dunes. Anyway, very susceptible to, sea level rise. Sorry, and I think I missed Newfoundland. Sorry, Newfoundland, the coast of Newfoundland, it is known as the rock. There's not as many forces for sea level rise to affect it, but there are still some communities in these, especially the Burin Peninsula area, Stephenville, some areas that are still susceptible to that. Sorry about the flicking. I practiced it and I still messed it up. Oh, and just a note, there's also First Nation communities as well that we've included in this study. And so we take a look at the way that they've put together their adaptation responses with respect to these concerns. The populated communities identified by territorial contacts in Northwest Territories included these 4 communities in particular. Interestingly, the literature highlights even the small area, how sea level rise will impact on these communities to different degrees, with Tuktoyaktuk here being impacted to the highest degree, even in comparison to these relatively nearby communities. In British Columbia, there are 4 main regions that were identified, as well as several Indigenous communities. The greater Vancouver area, including the cities of Vancouver, North Vancouver, West Vancouver, Delta, Richmond, Surrey. There's a very high population density there. According to the census, it's 918 people per square kilometer. So if we compare this to Atlantic Canada, a very generous estimate for Atlantic Canada would be about 50 people per square kilometer, but that is not consistent across the region. And of course, there are several Indigenous communities right within that risk area. We've included Squamish as well. It is in a very low-lying community, or it's set up in a very low-lying valley surrounded by mountains and is at the head of a tidal river, so it will have some impacts from sea level rise. Southern Vancouver Island, again, very highly populated and low-lying area. And then the Haida Gwaii region as well will also be subject to some of the biggest impacts from sea level rise. Again, there are many more communities at risk of sea level rise exposure than we've shown here. It really wasn't practical to look at every single community. So what we did is we tried to highlight the ones that are most impacted or will be most impacted by sea level rise specifically. So we got another poll question here. Where are you from? So I'm just wondering who's here around the region. Are you from coastal areas? Are you from somewhere maybe in the interior and are just wanting to learn a little bit more about sea level rise? So right now, there's quite a few people, about equal numbers from Atlantic and BC. Almost half the folks are not from coastal areas, so that's interesting. Just a small population group from the north participating. All right, so moving on to part 2 then. The question of the day was, how can public health be impacted by the slow onset of sea level rise? I mean, sea level rise, the projections are to 2100. How is that going to have a health impact? The answer to that, well, we weren't sure, and we immediately realized just from a really quick look at the literature that there aren't many reports that specifically look at this question, which I guess in itself makes it an interesting research question. We undertook a semi-systematic literature review. It included academic literature as well as publications by provincial, national, and international agencies with expertise in public health and climate change. In the first round, we only found a handful of reports that specifically looked at the connection between sea level rise and health. And while sea level rise on its own is that long-term creeping climate issue, it's well understood that sea level rise intensifies the impacts from coastal erosion, coastal flooding, and storm surge. So the literature review was broadened to include some impacts that could be exacerbated by sea level rise. So with that broadened approach, we were able to identify a much wider range of reports and studies, more internationally based than Canadian, that drew indirect connections between sea level rise and health-related outcomes. Usually the connections between health and sea level rise were related to flooding impacts and health, or inundation and damage to public services, so wastewater infrastructure like pipes and lagoons, salinization of drinking water supplies, that kind of thing. These 2 slides summarize the findings of report 2, which is available fully online. So I'm not going to get into too much of this detail, but I'll just hit the highlights for you. So given sea level rise's slow onset, the physical risk of injury or mortality due to sea level rise alone is pretty low, but it does exacerbate other coastal impacts. And there are potential health outcomes. Increasing incidence of infectious disease are possible due to contamination of both recreational and drinking water sources, but as well from contamination of coastal foods following extreme events, which can lead to bacterial contamination of the water. Saltwater intrusion into drinking water supplies is another significant concern globally. Here in Atlantic Canada, it has been a constant concern because many of our coastal communities have on-site wells, which are really difficult to protect en masse. Municipal water systems in BC are less at risk for salinization, at least in relation to sea level rise, as many water sources are upland and are, of course, required to meet the public drinking water standards. Further, rising water tables in coastal areas as a result of sea level rise increase the risk of groundwater contamination from buried sources. So whether those are industrial uses, decommissioned landfills, underground storage tanks, and then inundation then could lead to a wide range of acute and chronic illnesses if people are exposed to those contaminants or the contaminated water. Sea level rise may expand the habitat for disease-carrying vectors as well, such as mosquitoes. There's an potential increased incidence of coastal inundation by flooding that will impact coastal homes, which will need to be properly remediated to prevent mold growth. So there's also an air quality component as well. So as you can see, we took a really broad approach in considering all the various ways that increasing sea levels might impact on health, most of them indirectly. What we found is that it is really difficult to parse out sea level rise from other climate change hazards, and that the health impacts often overlap or are interrelated. Probably the two most concerning health risks resulting from sea level rise, according to some of the experts we talked to during this project, are the potential impacts on mental health and on the social determinants of health. The threat of loss of homes, food sources, and either temporary or permanent displacement can have significant impacts on individual health, family dynamics, and community bonds. When we talk about compromised social determinants of health, this is a really broad health risk affecting virtually every aspect of individual and community life. With sea level rise, the loss of land due to encroaching seas, erosion exacerbated by sea level rise, or inundation affect many aspects of life. So one example is the loss of cultural connection of land, or to land, sorry. And there's a body of research particularly around Indigenous communities, about the loss of culturally significant lands, such as traditional food gathering places, ceremonial locations, burial grounds, and archaeological sites. This loss of connection can result in health outcomes such as mental illness, or chronic stress, which can then lead to higher rates of hypertension, heart disease, and the like. For Indigenous communities and other small coastal communities, long-term sea level rise also introduces challenges in food security, particularly for traditional subsistence food sources. This was a major concern in the north, but as well for other coastal communities on the other two coasts as well. So that was a really quick summary of that report. Again, the details are available in full on the website. But we'll go now into part 3. So this part looked at community-based planning approaches related to sea level rise, and we wanted to see if health had been considered at any point in relation to sea level rise. As a land use planner who's written lots of plans and looked at lots of climate adaptation plans or helped prepare them, gut instinct said that this was not done very much, certainly not the connection between sea level rise and health, and probably not health to any great degree. The other thing that the thing that we did is we looked at studies, reports, and climate change guidance documents at the provincial level. These high-level documents are often used as guidelines from which local approaches are developed. So the idea was to see how sea level rise and health were considered at that higher level in terms of, what kind of way that the local communities would take a look at them and consider these at the local level. Generally speaking, sea level rise was noted as a concern more often than health. And then when health was addressed, it was usually in relation to extreme heat and air quality concerns. So not really in relation to the flood issues. One notable exception was Nova Scotia's recently released climate change risk assessment, which used a health lens to determine climate risk for the province. Nonetheless, not one of the provincial or territorial documents directly linked sea level rise with potential health outcomes. There were possibly some indirect references, but nothing direct. When it came to looking at the documents from the community level, we went back to our maps from phase 1 of the project. So as an example, I'll just show you what I did. We'll take a look at B, the Northumberland Strait area. So this area right here. So I drilled down to the community level and tried to find documents for some of the key communities that were identified. Many times these key communities were recommended by provincial or regional contacts who knew of particular susceptibility to sea level rise or to work that was already being done. In the document scan, the idea was to review documents that were prepared for and adopted by coastal communities. So again, they included climate vulnerability and risk studies, coastal assessments, and climate change action plans. We also included land use plans. So those are official plans, municipal plans, rural plans, they're known by various names. We included these because they're usually mandated for municipalities, and they are the documents that establish local policy to control land use and development. Overall, within those areas in Atlantic Canada, the North and BC that were noted in phase 1, we identified 58 communities. So those could be municipalities, regional governments, First Nations, or the like. For these 58 communities, we scanned about 140 documents that were either publicly available or shared through contacts. Some of these communities identified only had land use plans. So, and again, for the most part, these are required. Unfortunately, some of them were really old. They're supposed to be renewed every 10 years, and some of them were well over 20 years old. So in those cases, not obviously no work has been done from the sea level rise or health perspective. Some only had very early climate vulnerability studies, which means they're just starting on the road. Of course, the larger centers like Halifax and the Vancouver area municipalities had multiple types of reports. So, there was a lot of information that could be used there. And then there were some communities that had no plans or land use plans or community adaptation plans at all. So it appears to be that the current approach to planning and climate adaptation in coastal areas of Canada is a bit hit or miss. And we'll talk in the next section about why that is potentially. In the documents that we reviewed, adaptation measures tend to mimic the approach to flooding. So sea level rise responses and adaptation actions tend to focus on the 4 types of physical adaptation strategies, which is protect, accommodate, retreat, and avoid. And they were identified, and some even identified the health implications of these approaches. For those of you that don't know, just really quickly, protection generally involves building barriers between land and water, be it coastal armoring or construction of grassed berms or dikes or engineered seawalls. So it's very much a physical barrier between land and sea. Accommodation measures include options such as salt marshes that allow water to flow further inland as needed. So it's much more of a way to allow water to move more naturally. Retreat measures are often the result of are often the physical relocation of buildings, assets, or even communities away from coastal hazards. And then avoidance is using preventative measures, such as those land use regulations to restrict development in coastal hazard areas. The other piece in this, when we were going through the review of the coastal or the community approaches, that the social determinants of health, several reports at both the provincial and territorial levels and local levels did note that sea level rise could have impacts, particularly for Indigenous communities, on the social determinants of health. The potential loss of traditional food harvesting areas and important cultural places or significant archaeological sites was recognized in a number of these, not all of them, but in a number of them, so that it was something that was recognized, which is important. Okay, so now the question is, well, in part 4, we want to find out why health maybe wasn't included as often, and what could be done to better integrate health into adaptation planning for sea level rise. What we did is we undertook 4 regional discussions. Each discussion had, 6 to 9 participants. We had 1 in BC, 1 in the North, 1 in the Maritimes, and then 1 in Newfoundland and Labrador. Participants included local and provincial territorial representatives with expertise in climate change, sea level rise, public health, or community development. So when asked about health-related impacts from sea level rise already being seen in the communities, participants noted that drinking water quality and quantity were priorities. Some recognized that the mental health issues resulting from lived experiences seem to be increasing, and the compromised social determinants of health were also identified as being linked in some way to sea level rise. So it's not that they don't know that there are health implications, it's just that they're not generally articulated in the adaptation reports and things that we see. When participants were asked about sea level rise adaptation measures, discussion generally centered around protect, accommodate, retreat, and avoid ideas, which reflects, of course, what was found in the adaptation documents themselves. Generally speaking, protection seemed to be the most popular and highly used approach. Coastal armoring, such using riprap or large boulders or cement slabs, is regularly used. Unfortunately, these types of approaches can, over the long term, cause more issues for coastal areas on either side of these developments, and can sometimes cause more problems, over time on the site itself. However, they are commonly used because they're seen to be the least intrusive, so that it allows people to go about their business without making significant changes to their coastal lives. Accommodation measures are growing in use. There's several nature-based solutions are being tested in coastal communities and appear to be becoming more acceptable. And as well, they tend to have more co-benefits than protection measures. Retreat is mentioned in adaptation plans quite frequently, and it was discussed in the focus groups as a likely endgame for many coastal communities, but it was acknowledged that the way to that community decision is difficult, it's emotional, and is often very political. Avoidance measures, as a planner, this was not surprising to me, but they are rarely used to date. So this is development control in hazard areas. At the provincial level, so I'll give you a couple of examples of how complicated it can be. Nova Scotia and PEI have both attempted to manage coastal development recently. However, March 29th, so less than 2 weeks ago, the Nova Scotia government delayed the expected proclamation of its Coastal Protection Act with no future date given. We're not sure why or if it'll ever be proclaimed. And 2 months before that, February 1st, PEI actually issued a moratorium on development along the coastline. But when it did that, it's a little one-page document. It gave no details to municipalities on how to implement it, and it still is allowing exceptions by special permit. So there's a lot of very gray and uncertain areas in there. Not 100% sure where that's going. So again, it unfortunately becomes a political hot potato as well. So in terms of other perspectives on incorporating health and sea level rise into adaptation plans, focus groups of the participants suggested that too much emphasis is being placed on risk to property and infrastructure in community decision-making rather than the link to human impacts. The conflict may lie in the established silos of jurisdiction, right? Health is provincial, infrastructure is local. So this creates challenges for ensuring that adaptation actions take into account public health considerations. There doesn't seem to be a lot of cross overlap. Everyone's very busy, so there just doesn't seem to be a lot of work that happens to make sure that health is considered locally. There was recognition that health impacts of climate change generally are not well understood at the local level. Working with communities to share information and build understanding on the broad health impacts, including but not just those from sea level rise, is important moving forward in community-based climate adaptation planning. And I would say that for sure, having done the Health Adapt project as well. Probably one of the most significant changes that could be made would be to include social determinants within climate risk assessments. So when municipalities and regions are doing climate risk assessments, to make sure that there is a consideration of the social determinants of health when we're looking at what the impacts of losing, this, whether it's a dike or this pipe or, a lagoon to inundation, if that's one of the risks. So again, they would not only focus on what would be impacted by sea level rise, so buildings, land, and infrastructure, but on who and how the impacts might be manifested. Discussion participants noted several challenges and opportunities for adapting to sea level rise. Funding is needed to make capital investments in communities, and it is available at the federal and provincial level. There's funding pots available, but it's also a challenge as some coastal communities lack the internal capacity to know how to apply for funding, what to use the funding for, and how best to implement adaptation projects. Data and surveillance is another thing. A lack of data is a barrier to adaptation. Without firm understanding of what's been happening. It really is a bit of a challenge for decision makers, but determining what to measure, how to interpret it, and how to use the data in a meaningful way is another challenge at both the local and the provincial and territorial level. Again, going back to the Health Adapt project, I don't know if there's a couple people on the call or on the webinar here that took part in that. Really challenging to figure out what those baseline numbers are to compare them in the future, using the data that's available, and attributing any change to climate change is another really big challenge. So this data issue is something that is an issue for sure. Managed retreat or planned retreat is another challenge and opportunity. I mean, it can involve anything from moving an entire community away from a hazard to smaller measures, such as moving some buildings to create space for retention ponds to accommodate rising sea levels. It might also involve limiting opportunities to expand or rebuild following an event. In communities where retreat is the only viable option, it's vital that any community discussion be done in a way that is thoughtful and, using a holistic approach. So it isn't just about the infrastructure or the buildings, but it's about the people that are impacted. Land use planning, of course, is another challenge and opportunity. It's critical for coastal communities to incorporate climate change into decision-making. This might include zoning to limit further development in hazard areas, identifying appropriate locations for new infrastructure to avoid impacts from future sea level rise related hazards, and ensuring safe access to services, whether that's healthcare, sanitation, drinking water, or food. Legislative policy and resources. Some jurisdictions are considering instituting coastal development, as I mentioned earlier, with coastal development policies. So Nova Scotia and PEI's examples. New Brunswick tried to do it about 20 years ago and were really not successful in being able to enforce it. Again, it requires political will to address extreme development pressures in these attractive coastal communities that may put people at risk in the long term. Multidisciplinary efforts is another really great opportunity. Coastal communities depend on good information, science, and joint decision-making for coastal resiliency. So it's important to ensure that community members have an opportunity to learn from and work with technical experts, practitioners, and are supported by government and non-government organizations. So CLIM Atlantic and the work that it's doing is a really good example of how, that's starting to certainly happen in a bigger and better way. And I just want to touch on local capacity again. It includes having an understanding of the risks associated with climate change and sea level rise, as well as the ability to seek the funding, undertake the studies, and effectively implement adaptation measures. So many small coastal communities just don't have the human resources or the financial resources to actually pursue this kind of thing, that it becomes a very big challenge. So I don't even know how far we are on this, but in terms of the synthesis of findings, I just want to, point out a few things as we, to take away from these 4 separate reports and kind of summarize what we've found in them. So we know that the direct impacts of sea level rise on health are difficult to parse out from the varied and broad impacts of climate change. Sea level rise impacts on health are intertwined with other climate hazards. And then those hazards, are potentially being impacted and exacerbated by sea level rise. Sea level rise may also have a direct impact on saltwater intrusion and water and soil contamination. So it comes from a variety of sources. And then, of course, some communities are at higher risk of experiencing health impacts, not only due to their geography, but also due to heightened sensitivity to risks based on cultural, historic, or systemic inequities as well. The majority of coastal communities at risk of exposure to sea level rise have developed community-based adaptation documents and acknowledge sea level rise is a significant hazard, usually in the context of gradual long-term impacts. Most community-based adaptation documents focus on the impacts of sea level rise on infrastructure and the built environment, though. Health impacts from sea level rise may be considered indirectly in the context of coastal flooding. Effects on impaired access to emergency services, damaged wastewater or water or wastewater infrastructure, salinization of agricultural land and drinking water supplies, and on the mental health impacts. Community-based adaptation documents in Indigenous communities, we found were more likely to consider adaptation actions like infrastructure improvements based on community health and social determinants of health. So they really had a much more holistic and broadly considered determination and justification for doing infrastructure improvements in comparison to non-Indigenous communities. Just a couple of other findings. Communities that discuss sea level rise generally don't link it with current issues and rarely link it to health at all. Initial reaction when I first started sending out requests for key informant interviews and the focus groups to discuss health impacts of sea level rise with people from communities across the country, some of them said, well, we don't look at health. That's a provincial or territorial issue. But when pressed, it was obvious that some consideration of public health implications does exist at the local level. It just isn't often fully articulated. So the priority that many communities have given to ensuring that public infrastructure, emergency access, water lines and sewer systems, that they're protected and functioning ultimately is a public health action. So again, it's just not as directly stated. And again, the whole protect, accommodate, retreat, and avoidance ideas in terms of adaptation responses to sea level rise are considered by many, but most adaptation plans recommend a combination of these approaches. They are each unique in terms of what they recommend, but most communities will end up having some kind of combination of these approaches depending, and it'll be unique to each local context. The other thing that came out of the research is that the adaptation approaches themselves, rather than potentially the physical effects of rising water, may have the most impacts on community health. So it really is something that we need to think about moving forward, that even our adaptation actions themselves can impact human health. If communities choose to protect themselves by coastal armoring, while their erosion risk is reduced, residents will still experience the increasing effects of storm surge and flooding, which, have their own impacts on health. If communities or parts of communities are forced to retreat, there are other but possibly no less significant health impacts that can be experienced. So I think that was an interesting takeaway from this. It's not just that we're not going to erase the health impacts from climate change by adapting one way or the other. We really have to be aware of how the decisions affect people. So coastal communities need access to meaningful data. They need to better understand the impacts from sea level rise from both a health and an infrastructure perspective. And what they really need, and this was emphasized by several folks during the focus groups, they need assistance to implement solutions. We don't need to plan and plan and plan and plan anymore, but we need to figure out how to identify the priorities, apply for funding, manage large infrastructure projects, assess the impacts, and etc. So with that, we hope that the public health, local government, land use planners, academics, and provincial and territorial partners can use these project resources as a starting point for working together to better integrate health considerations into their climate adaptation planning for coastal communities throughout Canada. And with that, I will turn it back over to Leah.